So what I'm going to do is
Respiratory, did you say?
I'm going to be starting week 6, and we're going to be going over a PowerPoint. The new lead on PN, Bethany, took it, condensed it really nice, and I like what she's done. It's not that many slides, and respiratory cardiac can be pretty rough. Do you notice how we are now getting weekly review sheets that you have to fill in? I've been putting it on your announcements. I would study from these. These are all the concepts you need. Are you aware that they're there? Every announcement. We've actually already arranged for your next review because the review week is Thanksgiving week. So we're going to do Sunday, Monday, Tuesday, nothing for the rest of the week. And then somebody's doing another one on Sunday before week 9, which is your exam. So there's going to be those there for you. And as I said, when I post all the information, you'll have all the Kahoots, all the worksheets, everything in one place to open it up and look. Just like the reviews, when I do it, it's one announcement that I edit. You're not going to see 3, 4 different announcements. Here's this review, here's that review. Taking 3 courses, and some of you are in 4, and I know it. I don't want to confuse you. So I try to keep you organized in the way that I can, all right? Remember this week there's a CJ Sims, and your CJ Sims are counted heavily. Make sure they're done, okay? So you have till Sunday for that one. Over half of you have done it already, so thank you for that. So let me open up your PowerPoint and we'll go from there. PNR week 6, respiratory cardiac. Respiratory and cardiac is the brunt of all of nursing, isn't it? You have to breathe and you have to have a heart. So these concepts are really important. If you have that worksheet there, open it up and go down and start filling it out as we do this PowerPoint, because the answers will be here, okay? So respiratory, what is ventilation? It's breathing air in and air out. We know that all the muscles, the diaphragm, the brain, and all those receptors, they make you breathe, right? Without all of that, there would be no breathing. There are different numbers for different age children. I sent you, I believe, on the first week sheet on different vital signs for different age groups. And it's just that in that newborn or the neonatal period, those first 28 days, your normal respiratory rate is 40 to 60. Heart rate is 140 to 160. And they all go down in numbers as they get older. Blood pressures go up, but heart rate and blood pressures go down. So why do you need to know that? Well, how would you know a 1-year-old who had a respiratory rate of 50 if that was good or bad? Well, at 1 year old, they should be 20 to 30. So we know that that kid's in respiratory distress. They're tachypnic, okay? So very important concept that you know these values, because you will see that you can make a good judgment by just knowing it. Now, O2 saturations. In adults, we look for over 92 usually, but in children, we want it greater than 90%, okay? 90% is acceptable. Children always have upper airway mucus, right? It does obstruct it a little bit. So we do accept 90s without any application of oxygen. Now, what are some of the disorders that we get? Well, nasopharyngitis. Well, that's your pharynx and that's your nose. And we know it's all of that, mucus and irritation. We could call it a common cold or coryza. That normal cold me and you get is a coryza. It could be allergies. Many of you live up north and the spring comes and all of the blooms come out and then your allergies go crazy. I used to be in the autumn, where you start burning the leaves up there when you have big piles. I used to love doing that when I lived in New York, but all of that really alerted my allergies. Cats and dogs can do it too. So upper respiratory infections, common occurrence. So one of the things with upper respiratory is that, it's a virus usually. So we treat them just with the antipyretics, Tylenol and your Motrin, acetaminophen and ibuprofen. But, and that's how we treat a fever. But remember, what happens with a fever? You lose fluids, right? Once that fever breaks, what happened? You sweat. That's extra fluid you're losing. Make sure we're replacing fluids in your upper respiratories and any condition that has a fever, okay? You have a fever, increase fluids. Now, acute pharyngitis, strep throat, right? Viral pharyngitis is extremely common. You go in and your throat hurts and you have a fever, you don't feel good, and they do a culture and they do a strep test and it's all negative, negative, negative. It is viral. Again, what do we treat it? Is of course acetaminophen, ibuprofen, give them some fluids for extra and just rest. Now, rheumatic fever can cause can be caused by a parent who doesn't give the whole dose of antibiotics to a child that has strep throat. It's one of the things, and you see rheumatic fever, glomerulonephritis, the abscess, otitis media. These are you have a simple little strep throat. The doctor orders a penicillin. That's what you give, whether it's amoxicillin or augmentin. Those are a type of penicillin, and we give them. We need to, as nurses, make sure those parents do the whole dose of it and not skip any. Oh, they're doing better. It's such a chore getting this child to take that medicine. And oh, I don't want to, all right, it's enough. Well, it's not. So you don't treat that strep all the way, it goes and causes rheumatic fever. And one of the big concerns with rheumatic fever is it attacks the heart valve, mitral valve, and it causes permanent heart valve damage, which requires some sort of repair or surgery. So we need to complete it. It causes other stuff, but with the antibiotics, everything goes away. Another thing is glomerulonephritis. That means strep attacks the kidneys. And the kidneys start not working well, and you see you're not urinating, you're oliguric, you blood pressure goes really high, and then even your urine is like foamy and dark. And it you start retaining fluid. Again, this is treatable. When we figure it out that it's due to the strep throat, we just give antibiotics. So all of these things, meningitis, mastoiditis, ears infections, it's all staph infections created from just a simple strep throat. So again, you can see the importance on making sure that we treat it properly and then get it checked. Now, some of the conditions with respiratory, sinusitis, it's, very painful, usually frontal headaches and, right over the cheeks, and it's all this goop that's in there. Remember, your oral pharynx has staph in it all the time. But when it gets to the point where you're sinusitis and you have the pain and all of this mucus, you're going to need to be taking antibiotics, okay? Croup, or another word for it, laryngotracheal bronchitis. Larynx, trachea, and the bronchi are all affected and swollen. And what that causes is the air can't get in because all of the upper airway is swollen. So you hear an inspiratory stridor, okay? We know if they get upset, we know if they are crying a lot, coughing a lot, it's going to just make those symptoms worse. We don't give any sedatives or anything because, like opiates, pain medicine, even, we used to give cough syrups with a little bit of opioids, but we found it stops the coughing. Not only that, but it also affects the respiratory center, and children have gone apneic on it, and that's why we don't do it anymore. Cold water humidifiers are great in the room, put it there. Many times children have croup, parents bring them, and it's usually at night, which drives the parent nuts. Bring them into the urgent care ER. They go out in the cooler air and they are not coughing as much. It happens all the time. Now, if you do not treat croup, that swelling, laryngotracheal bronchitis, that epiglottis, which is in the oropharynx, is this tissue that covers the trachea when you swallow so you don't inhale food into your lungs, okay? And in epiglottitis, it's an itis, it's a swelling, inflammation. It covers the larynx and you can't get air in. It is an extremely dangerous situation and is an emergency. This child has a hard time getting air in because it's that epiglottis is covering the trachea, so air can't get in. These children usually will find, like the old people in chronic obstructive pulmonary disease, they'll be bending over trying to get a space where they can get air in. They can't swallow anything. They're just drooling. They've got this garbled voice because of all the swelling that's there. Um, Usually by this point, this is swollen. There's no more coughing going on there. Now, what is our treatment? Well, we can give all sorts of aerosols and steroids, but your responsibility as a nurse is to look for the most severe thing that could happen and have respiratory equipment, tracheostomy tray, and an intubation tray at the bedside. Because once the physician goes in and looks inside, he is going to look, he has to, he could make the swelling worse and he could cause that child to stop breathing completely. And we know we've got to get those respirations back as quick as we can. Now, bronchitis is that cough that you get at nighttime. It's dry, no mucus comes up, rarely has to do with a fever, but cough, 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 and it's always all night long. I mean, this is nobody in the house is sleeping. So, usually, what we do for these children is to give a cough suppressant. This one, you want to give that Robitussin or something to stop that coughing from going on. So that's bronchitis. Now, bronchiolitis is another name for respiratory syncytial virus or RSV. Many of you, if you've had young children, I'm sure your child has had some sort of RSV at one point or another. For you and me, it's a common cold. But for an infant, that first year of life, they suck, swallow, and breathe, right? And they're obligatory nose breathers. And now you put mucus in the nose, they can't breathe. So this is something that needs to be treated. Again, a virus. It's the most common cause of viral pneumonia. Again, it's that first year of life I'm talking about in infancy. We know pneumonias can happen, consolidation of some bacteria or even viruses into the lungs, and we will treat that again symptomatically. Tonsils and adenoidectomies. Now, we know children, a lot of the time, they have chronic throat infections, or they're snoring really loud, or they're having these ear problems, and they'll do tonsils, adenoids, and tubes all at the same time, right? And they'll get it and try to open up those airways. One of the things we need to tell our parents and the child, if they're swallowing a lot, especially when they're sleeping, most likely it's blood. Think about what they have to do. You know, those big tonsils are these big round things, and adenoids are a little lower. They literally take them off and cauterize the area and make big scabs. And that scab, like any scab anywhere in your body, could break open a little bit, right? And it will bleed, and it will bleed, and it will bleed. So that is something that we need to get these children back to a doctor. You know, just to let you know how serious it can be. I did have this little 7-year-old girl 1 week after tonsils and adenoids had just come from the ENT, and on the way home, coughed and vomited big clots and kept vomiting big, bright red clots of blood. When she got to me, I got a big basin This is 7 years old girl, started to fill it up with blood. And of course, she got pale. So I said, all right, I'm not doing the assessment here. I picked her up, brought her into the trauma room. I got help, stuck in an IV on her, got the physician, of course, and gave her fluids to replace the blood. I mean, she was getting a little bit confused because her blood pressure was going down. Her heart rate was 160, I believe, on the monitor. So tonsils and adenoidectomies, teaching that can save a child's life. I just wanted you to know that as an example. Never give milk or milk products. It causes the phlegms and causes them to, they're trying to clear their throat. You don't have to drink a glass of milk, you a little bit. So we can give ice, start out with, we can give ice pops, etc. And they recommend don't give anything red because it looks like blood. Now, asthma. All right. The difference between croup and asthma, they're both coughs and both wheezing and difficulty breathing. Well, croup is swelling up here, air can't get in. Asthma, it's lower where the bronchus is all inflamed. So you get air in easy. This is all open. But once it gets down, it gets trapped and you can't get it out. So now it's expiratory wheezing. And they're coughing and wheezing, and all the accessory muscles are going. Children, you'll see nasal flaring, especially on younger children. You're going to see their chest and all of their intercostal and supraclavicular. You'll see it all just really retracting. You can see it very, very easily. Now, when you're giving these medicines, you give albuterol, right? It's your rescue. And I've had many young nurses who come in at question. I've had parents, ex-students, etc. About you have asthma and how frequently can you give those aerosols? Well, if you have a child who can't breathe, you're going to give one after another after another. I mean, we know it elevates the heart rate, but if you're not breathing, nothing else matters, right? Now, if we're giving these aerosols, we are giving steroids, okay? We are giving epinephrine in aerosols and giving it, sub-Q. And then aminophylline is an old drug. It's given in an IV continuous drip, and you're still not doing good. Usually, this is like after almost like a 30-minute, we call this status asthmaticus. My husband had this 4 years ago, right around Thanksgiving. So I always give thanks because we got him home, and with me there, he didn't get intubated. It was his big eyes, the pupils dilated. He looked at me and he couldn't breathe. He was scared. It's like being underwater and you can't breathe. So it is an absolute medical emergency. He was in intensive care for 12 days, and almost every day he was having some sort of, attack. So respiratory asthma, an episode, usually we can do just aerosols, the albuterol, some steroids, sometimes racemic epi, but these children usually do all right. When it gets to status, nothing's working. So many of them do end up intubated, but we try not to because it's hard to extubate, get that tube out once it's in. Now, cystic fibrosis attacks the lungs, mucus in the lungs, and mucus in the small intestines. So affects digestion, so nutrition, because the pancreas doesn't work good. And it doesn't have the enzymes it needs to absorb fat. Because you don't have stuff to absorb fat, you're going to see a very nasty smelling. It's probably the worst smelling stool you'll ever smell. And it's frothy, almost like beer froth. Yeah, it's pretty gross. And it's because of all the fats coming. And then, of course, you have a lot of gas because of the fat. Remember, you're losing all of your vitamins and everything there. So we replace that with an enzyme before every meal. Respiratory It's like their lungs get clogged up, thick mucus. So we need to have them on really intensive respiratory care, aerosols, usually every 6 hours, postural drainage. This is the child, you'll see that vest they put on, which vibrates, because or else we'd be there clapping them, or one of those machines that, it like vibrates on them. But it really loosens it up and lets it get out. These children, we want them to exercise. We want them to get up and use their lung. I always say go swimming, because going underwater, you hold your breath, right? You create pressure. It's actually peak pressure. It holds open your lungs when you go down. So diet, they're not getting fat. So high in your sodium, because we diagnose this through a sweat test of sodium on the skin. And it should be high in protein and actually carbs too, because fat's not getting there. Trying to keep those lungs from getting infections, because it's like a petri dish there. Bacteria goes down there and it just starts growing. And of course, having that child rest as they need to, and telling them things that they will see when the child is starting to get sick, so they can maybe increase their aerosols, or maybe get antibiotics started quickly. Now, one of the things with cystic fibrosis is fertility. Now, women are high risk. They usually can get pregnant, but men, somehow mucus stops that vas deferens from letting the sperm getting to the mother, so that they can, have his wife pregnant, right? So they say 1 year after a bilateral lung transplant, a man, now all of a sudden the vas deferens work and they can produce sperm and they can get pregnant. Okay. So females, it's hard, especially if those fallopian tubes are blocked with mucus, but usually it's more the man that has a problem. Bronchopulmonary dysplasia, BPD, we used to call it many years ago. And it's basically your very young, small newborns that are born and their lungs don't work yet. They don't have alveoli that are open, they're under 34 weeks, and they require intubation and oxygen. And their lungs get a little bit, quote, damaged, whereas the ends of their lungs, they tend to get really tight and they don't let oxygen and carbon dioxide exchange. And that's the thickening that I'm talking about. So it doesn't allow oxygen exchange. So these children will be more short of breath. Many of them end up on oxygen or medicines for life with it, just to let you know. Sudden infant death syndrome, this is a condition mostly in males, more males than females here. And it's a sudden, unexpected death. Usually most between the 2 and the 4 months of life. It could be due to sleeping on their tummies. We don't do that anymore. We put them on their backs to sleep. And that's the reason why. Also, it could be sleeping with mommy. It could be sleeping with stuff around and blankets and they smush their face in it. Smoke also in the house can cause it. So, and if they're too hot, these are all things that can precipitate it. They say a breastfed baby has lesser chance of having SIDS death. So let's go into the heart. Now, I worked 10 years at in Miami at a congenital heart defect unit. Absolutely my most favorite job I've ever worked. It's something that I didn't expect I'd love so much. And if we think about the heart, think about a hose and fluid flowing through it. Just happens to be little places where it's just blood going through a heart. Okay. And it always goes from the right side to the lungs, to the left side, and to the body. Very simply, right? So many times children are born with a condition. It's called congenital heart disease. It could be due to many different reasons or nothing at all right? Could be genetic, could be maternal, could be environment. It one of the things I tried to tell these parents, it wasn't because you had a Tylenol before you knew you were pregnant. It was not a glass of wine you had before you knew you were pregnant. These aren't things that would cause that because mothers will sit there and blame themselves for a congenital heart defect. Now, we know when a baby's inside mom, they have fetal circulation. So we know blood's going around where it needs to go. When they're born, now the baby has to take over for that. Now, there are two types of congenital heart defects. Cyanotic, which means the O2 saturations are less than 90%. And then acyanotic, where O2 sats are 90 and above. That's, the definition for that. Now, many times there's holes in the heart. So if we had a four-chambered heart and there in the middle is called a septum, okay? That divider between the right and the left side. Sometimes there's a hole between the right and left side of the upper chambers or the lower chambers. So if the upper chambers have a hole, you're going to see blood going always from the left side to the right side. It's the area of least resistance. And let me try to explain this. It's called a shunt. All right. So the blood goes out the left side with a lot of force because it goes to the whole body, right? And then it just gets back to that right side and goes into that right atrium with the last part of that heartbeat getting it there, right? So the flow is really slow. The left side has blood flowing really fast from the lungs into the left side. So if there's a hole between the right and left atrium, blood's going to flow back to the right side. It's not going to go against the pressure. It's going to go to where it goes there easier. There's lower pressure. And when it does that, whether it is that atrial septal or the lower chambers ventricular septal, we're going to see it right to left side. What happens in the right side of the heart? Right ventricle leads to the pulmonary artery and to the lungs, okay? I would suggest you look at blood flow. Again, follow a drop of blood and see where it goes. That PDA is what's open for fetal circulation, okay? We'll talk a little more about that. Now, a very common condition and tested, of course, is why it's here, is something called a coarctation of the aorta. Well, we know the aorta comes off the left side, goes in an arch. You've got three vessels going up to the head, right? And then it goes to the body. Well, it's like a hose. What if after those little three vessels, external, internal, carotids, etc., it's kinked? So, and it's open, but really little. Blood can't flow down, right? And the heart's still going to beat, 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 but it can't really get down. And that's called a coarctation of the aorta. If blood can't go down to the feet, it goes back into the lungs and it fills the lungs up. And that's coarctation of the aorta. Most common of all the cyanotic heart diseases is called tetralogy of Fallot. This is your TET spells. This is where the pulmonary artery closes up and blood doesn't go into the lungs. And we treat that by simply positioning an infant. We would take the knees and we would put it up to the chest quick. It's called a knee chest movement. Also, older kids who haven't been treated yet, had surgery, they're just going to squat on their knees. They do it automatically. So that is tetralogy of Fallot. Now, your mixed blood flow are some of your more sophisticated, complicated. The hypoplastic left heart syndrome means you don't have a left ventricle. You don't have an engine to your heart. It's small and it's, doesn't move. And we have to do many things to make that heart work. So hypoplast, most severe of all of them. As I said, shunt is blood flow. And we know it goes high pressure to low pressure. I've already described that with an ASD, VSD. And because it goes back to the right side, it goes back into the lungs, increased pulmonary blood flow. So looking at these children, mostly they're younger children that we see. Many of them in children, we're diagnosing congenital defects that we didn't really catch at birth. I mean, they're in and out of the hospital quick today. It used to be newborns were there a week many years ago, but now it's 2 days if you're lucky and you're home. And many symptoms don't show up yet. So what would you see in these kids? Well, their heart rate's up, their respiration's up. And because of that, and because they are, searching for oxygen, they tire easily. They're not going to eat well, right? So they're not getting nutrition. So you'll see the growth be retarded, and you're also going to see maybe they're not doing developmental things like just lifting their head up in the first 3 months of life. It's all part of no nutrition, oxygen, you're going to see delays. So the dyspnea, orthopnea, that fatigue, like I said, and you might say it's sort of symptoms like upper respiratory because most likely it's gone to the lungs. So it's more of a congestive heart failure. It's in the lungs. Now, children with congenital heart disease absolutely are working harder. Their hearts are working harder. Some repairs we've done, it doesn't make that it's perfect. So they shouldn't do competitive sports, okay? Nutrition, these kids burn calories all the time. I've got my daughter's husband's sister had a baby, has a VSD, hole between the bottom two chambers, and she's really tiny because her heart is working harder getting that blood around. So you could see how nutrition, she would have to have higher calorie formulas to make up for the extra calories she's burning. It's the same quantity of fluid because that's all she could take, but the calories are more, okay? And then always, if you're going up in altitudes, your lungs are shrinking, that can cause issues. And of course, cold environments, again, that causes vasoconstriction. So that coarctation of the aorta, a kink of the hose, right? So blood's going back into the left side of the heart. So if blood can't go down, you're going to have very low blood pressures on the lower extremities. And in alt cardiac, we do 4 extremity blood pressures. We are looking at that shunting, etc. Okay. So we're going to see lower in the bottom. Now, the upper extremities are getting all of it. You might even see older kids headaches and nosebleeds because the amount of blood that's going up because it can't go down. And of course, you're going to see higher blood pressures in the upper extremities. As I said, many things can happen with this. Congestive failure is the big thing. High blood pressure because the heart's trying really hard to get blood down to the toes. And with that kink, the blood can't get there. And an endocarditis could occur. We diagnose this with an aortogram. And what's that? Well, we have an aorta. We inject a dye and we see it's kinked at a certain place. Very simply, that's how it's diagnosed. So tetralogy has certain things that characterize what a tetralogy is. Well, it is, number one, cyanotic heart disease. It is an issue with the pulmonary valve and artery. Blood can't at times go up. Whether it's spasms or a piece of tissue covers it, something blocks blood from going up there. When you have decreased flow going that way, well, blood's got to go somewhere, right? It stretches that right ventricle. That's why it's hypertrophy of the right ventricle. And then the aorta sort of comes over a little bit, causing it's displaced. And the one thing is like a pop-off valve is that ventricular septal defect. It actually prevents that right ventricle from getting really big during these episodes. I had one child, Nathan, 1 month old, tetralogy of Fallot, 5 o'clock in the morning. I was changing his diaper and just changing his blanket very quietly. I wasn't harassing the baby much. He went into a TET spell. He went from O2 saturations of 100, and I swear it was 4 seconds later, to 10 O2 saturations of 10. And what did I do? Because you're allowed to. Knee chest immediately. And I was calling the doctor same time. The kid did fine. The kid came back. But you can see how scary this can be, right? And then there are those TET spells. And we know that these children, these are the older ones. Sometimes we diagnose them early and they're fixed early. Most of them, if we know, but some of them are later on with life and those TET spells. And what they do is they just all of a sudden they'll squat, and it's like all this, they just know what to do during the whole thing. And it does take something out of them. So they usually get tired and need a nap when they have one of these spells. Congestive heart failure, what is that? Well, it just means that the heart isn't working the way it should. And in infants, it's a congenital defect. Something's there. So what do you see? Well, I had a little girl who came in at three months old. She actually had coarctation. What did she look like? She was tachypnic. She was tachycardic. She was skinny. She was delayed. She wasn't lift her head up. She was sweating. And first thing I did is put my stethoscope on her lungs. And I went, ooh. And you could hear the amount of fluid there. And then, of course, I felt her pulses in her lower extremities. They were non-existent. So what do we need to do? These children can barely breathe and just lay there. There's no energy at all on them, okay? Their lungs are so full, their heart is so tired. So you can see this congestive failure, sudden weight gain. So our job is going to be monitoring that weight gain and doing intake output and daily weights. Monitoring, are we getting that fluid off of them? We're going to do what we call cluster care. You're going to do everything at once, but no, you can't do too much at one time, all right? If they are awake and crying and they're allowed feeds by mouth, give it to them early. You don't want this kid tiring out because you don't want the energy on crying. You want that on nutrition, because we know nutrition. And if they're sleeping, let a baby sleep. These kids aren't small, and they're resting. They need their rest. We usually give smaller feedings and more frequently. And oxygen is just to relieve the dyspnea. It helps them breathe a little easier, and they can, do a little more. And usually it's just feeding, because that's suck, swallow, breathe. That's all we want them to do. Remember these medications, what do we give them? Well, digoxin is very safe in infants. And we just give mics per kilo. We also give furosemide, your Lasix, right? Your diuretic. And we give it milligrams per kilogram. And these doses, make sure that we do check them. And if this child's going to be going home on this stuff, making sure that the parents know as the child gains weight, the doses must be altered so that they're aware too. Most parents of cardiac children are really into taking care of them and wanting to know everything. Actually, it was my great, I loved the unit, one of the most favorite. I loved the parents. I loved, the just taking care. It was like I could see hearts beating in my head. Yes, I am weird. So rheumatic fever, we talked about it, right? We talked about rheumatic fever due to a strep infection. What do we see in it? Well, we see swollen joints, again, that heart valve, mitral valve will be damaged. You're going to see these weird movements on these children, and we're going to see rashing. Usually they'll come in, their throat hurts, or maybe we take the history and we find it. So once we determine it's the strep that wasn't treated completely, we put them on that penicillin. And we put them on, it's a longer period of time and monthly. They're going to be getting some sort of penicillin for 5 years. We want to prevent it from coming back. We treat it again with rest because, again, it could affect that heart and it's an infection. These kids don't feel well at all. Anti-inflammatories, ibuprofens could be your anti-inflammatories. They could give aspirin for this one just to prevent blood clots on it. And if it's got to the point where these children's heart are affected, always we'll manage that failure, intake, output, daily weights, and maybe digoxin and Lasix, depending on the condition. Now, years ago, we didn't do frequent blood pressures on younger children, like especially going into the ER. Would be after the age of 5, we would do it. Well, now we're doing it younger than ever. And we have found out younger children do have hypertension. Well, what happens with older people with hypertension that's not treated? It hurts their kidneys, right? Same thing will happen to children if we don't treat it. So what we decided, we're going to find out what's happening, why do they have high blood pressure if there's some sort of disease, which means a full workup, right? And then we're going to be putting them on a diet. And it's low fat, fruits, vegetables, fish, poultry, low sodium, of course. We don't, any hypertension, we do that. And then have them with a little bit of weight loss, if that is their case, and some sort of exercise, something fun. You know, it says aerobics. I would say go in the pool, but for everything, I would say the pool is the best place because it is a very comforting place, and many like that. And if the kid is that adolescent, remember to tell them, you know, all of the problems if they smoke, they vape, any of those things, that they shouldn't do it. And of course, no drugs or alcohol. Now, Kawasaki disease is actually, I've always find it very fun to diagnose. Then my second place that I loved was the ER for 10 years there also. And Kawasaki disease is a viral thing where it's a viral vascularitis, systemic, which means vessels get swollen. And our biggest concern is aneurysms and swelling of the coronary arteries. Okay? What do we see? Very hard to diagnose because usually they come in and they don't have the tongue looking like a strawberry yet. And usually they don't have the eyes big and red and glowing in the dark, as I call them. And they don't have this petechiae. And their hands and their feet don't have any cracked, swelling, blistering, anything on them yet. Okay? Once we see that, we know what to do. So usually it's 7 to 10 days into an illness. And finally, they usually come to the ER and we go, oh, that looks like Kawasaki. We give intravenous gamma globulins. It's viral. It's not an antibiotic. It's going to do nothing. We need to boost the immune system. And we're going to be looking at those coronary arteries, right, with an echocardiogram to be sure. And this is a child that you will put on aspirin. Why? Well, aspirin is the easiest way to thin blood very easily. Sometimes, if you already do have a ballooning, an aneurysm on a coronary artery or anywhere that's significant, they will put them on warfarin therapy, again, to thin the blood and to prevent clots. So any questions about all that good stuff? Did you want to do the cahoots quick? It's a good one. All right, let me get it up for us. Yeah, we could do it in less than 15 minutes. I'm getting there. Now, I went through and did this, looking at all of those key concepts that we needed, and I made a Kahoots. It is a good one for you to look at. It's 33 questions, not crazy, but it's a really good one. It sort of goes on with that sheet that I gave you, the outline for week 6. So something to follow with it. There we are. Anybody want to win today? I know you were studying for an exam. I know Mildred wants to win. Erica, you want to win, don't you? Yeah, shake your head. Yes, I do. Anybody else coming in today? All right. Always remember to go over your Kahoots before you do exams. Big concepts are in here. And then you've got your worksheets too that follow right suit with it. Acute coryza is another name for what? That is your common cold. Yes, it is. Acute croup is also called. They use different terms for it. So try to bring these up so that when you see the word, you'll know. Croup, we know it's upper oral pharyngeal area, and you can't get air in. Inspiratory, right? It's also called laryngotracheal bronchitis. It's upper of your larynx. What term is used when describing the collapse of an alveoli? I mean, this usually happens when you have a patient post-op, they're not deep breathing, they're not coughing, they're laying in bed. It's called atelectasis. How do we, turn that around? Deep breathing, coughing, getting out of bed, exercising. What is tachypnea? We have orthopnea, tachypnea, dyspnea. What's a pnea? And then you can figure out the rest. Pnea is what we call respirations. And then tachy, which means increased. Very good. What will the nurse teach the child with cystic fibrosis to take and to facilitate digestion of nutrients? So remember I told you there's the lungs and the small intestines. The small intestines, the pancreas does not have the enzymes required to digest fat. So we're going to be taking pancreatic enzymes, okay? We will, of course, to facilitate digestion is the enzymes. What are we be concerned about is those fat soluble vitamins. And yes, they'll be taking supplements, but digestion, you need to somehow make that food workable for the body. So it's that pancreatic enzyme. When a child has a fever and upper respiratory, what should be included in the nursing care? Has a fever. What do you be worried about? Has an upper respiratory infection. What did I tell you should always do for these children? Well, we're going to give them the acetaminophen and ibuprofen, yes, and then we're going to increase fluids because they're losing insensible fluid loss. Very good. Asthma causes what? You know, a lot of times asthma is your younger children, and many do grow out of it. My husband had it as a kid, grew out of it for a while, and now as an old man, he's got it again. But it's increased doctor's visits, increased school absenteeism, and increased hospitalizations. Absolutely all of these things can be caused by that. Asthma is one of the biggest things that causes absence from school in children. What is the most common reason for pneumonia in infants? And it's your RSV virus, okay? Viral pneumonias are extremely common. I mean, most of us think you have pneumonia, you're taking antibiotics, right? Many times it is just viral. So they would do an RSV test. Which congenital heart defect causes increased pulmonary blood flow? So remember, increased pulmonary blood flow is more blood is going to the right side, right? How did it get there? And that is the holes in the heart because the left side is big pressure, the right side is minimal pressure. Goes from the most to least pressure. The atrial septal defect, ventricular septal defect, and then that thing that's open right after birth, that's fetal circulation, the patent ductus arteriosus. A child swallows frequently after a tonsillectomy and adenoidectomy. What might this indicate? We know if they are swallowing, this is a big concern for bleeding. And if we see that they're bleeding, they need to get to the doctor. They do go back and cauterize it and get rid of it. And as I said, it can be very serious. Signs and symptoms of respiratory distress include what? You know, bradycardia is actually the late signs, and this is when they're going to have a cardiac arrest. Confusion because there's no oxygen going to the brain, and of course, any noise, wheezy, rhonchi, rally, rails, and we know breathing fast, absolutely distress. What is an acceptable oxygen saturation for a child? It's supposed to be ACC, acceptable. Hmm. And it's 90 and above, okay? Above 95, kids aren't. They just aren't. Above 90 is acceptable. The parents of a 3-month-old with cystic fibrosis wants to know how their child got this disease. Neither parent has cystic fibrosis. This one's like very similar to like if you had a child with hemophilia or sickle cell. This is something where, you know, parents don't have to have the disease. They have what we call traits or carriers. If both, like in sickle cell, if both parents, mother and father, have the trait or carrier, there's a 25% chance that their baby will have it. Which fluids are most appropriate for a 5-year-old child with asthma, experience dyspnea, and fluid loss? Something we really don't think about. The kid's thirsty, they want to eat. They're breathing, their mouths are dry, they're losing fluid. Yes, it needs to be replaced. And we don't give them anything cold. Cold tends to spark coughing, even colder rooms in the hospital. So, room temperature water. Very good, guys. How long after a smoke inhalation injury are patients at greatest risk for pulmonary edema? This is another with when you have drowning. If a child drowns and it's at the bottom of the pool and you have to bring them up and resuscitate them for just a short period of time, it's up to 72 hours later that you might see some symptoms of it. Most of the time, these children will be admitted in an intensive care, like a step down, at least to be on a sat monitor and closely monitored. What findings are expected when measuring the blood pressure on all four extremities of a child with coarctation of the aorta? Remember that aorta is kinked. Blood can't go down, so it goes back. That being said, what do you see? You're going to see the blood pressure lower in the legs and higher in the arms because blood flows up there, but it didn't get down below. And your pulses, sometimes non existent. What type of diet should a child with cystic fibrosis be eating? Remember, they have a hard time digesting fats and they're losing salt out their skin like crazy. So we need to give them the salt shaker and we need to give them protein because fats are not working. Fruits and vegetables, that's not going to work because of the pancreatase that they need to take and the digestion. It's sodium and protein. And as I also said, carbohydrates. Blood flow between vessels of the heart is called what? Goes from the right side, left side to the right side. What's that called? And that is called a shunt. Atresia is A is without. That means there's no opening. Stenosis, osis is narrowing. Those are two terms that you should know. What is an atrial septal defect? An ASD. And it's an opening between the upper chambers. So a VSD would be opening with the lower chambers. Atrial septal, ventricular septal. Very good. Why do children with tetralogy of Fallot favor a squatting position? So when they squat, it changes the chamber pressures and it forces blood to go back into the heart and it pops open, that covering and lets blood flow to the lungs. Which comment by the parent of a 1-month-old infant would concern the nurse about a possible congenital heart defect? The congenital heart defect. There's something wrong. Blood's not pumping the way it should. What are some signs and symptoms? I said with that. And it's about tiring out easily, right? tiring out easily is the first thing that we would see. And then, of course, growth and development delays, not gaining weight, all of those things you'll see. What does the nurse explain that a ventricular septal defect will allow? Hole between the bottom two ventricles. Well, we know the left side, more flow than the right. So it's going to go from the left to the right. And then it goes through the lungs. And there is no reason for there to be any cyanosis. So the answer is shunt left to right, increased flow, and no cyanosis at all. What is a non-invasive procedure to determine if a heart is structurally normal and to find a murmur? One of the first things that we used to do, even at 2 o'clock in the morning, we'd call these techs in to do this. We want to know what that heart condition is so we know how to best take care of that child. We shouldn't have to assume. We want to see it. And it's an echocardiogram. The electrocardiogram doesn't find murmurs. It does tell you a little bit about the heart, but it's the echo. It's like an ultrasound for a baby. Same sort of thing. Rheumatic fever causes which inflammation? And this chorea there, that's those movements that you see with rheumatic fever. Really they're very jerky and they go away with treatment. But rheumatic fever, the big thing we're concerned about is carditis, which can destroy the mitral valve. A child recovering from rheumatic fever needs to receive monthly injections for 5 years of what medication? Rheumatic fever is caused by what? Rheumatic fever caused by a strep infection that was not treated. So, what are you going to be giving prophylactically after the treatment is done? We're going to be given penicillin every month for 5 years. That'll prevent it from coming back and affecting the heart. What life-threatening illness is caused by H. influenza that causes swelling above the vocal cords? Life-threatening is the key words here. Which one there is life-threatening? And that's how you're going to answer that question. And that's epiglottitis, okay? Laryngotracheal bronchitis is croup. That's not life-threatening. If we don't treat that, it turns into epiglottitis, which is life-threatening. And it's the H. influenza virus, very likely. The nurse should prepare for emergency intubation when caring for a child with what diagnosis? Which one of these has to do with an airway that does not open and can't work? And that's your epiglottitis. Very good, guys. We're almost there. How do you treat primary hypertension in a child? And that is your DASH diet and increase the activity, some sort of exercise. And if they're overweight, a little bit of weight loss would be good. What congestive heart disease is diagnosed with an aortogram? That means something happened to the aorta, right? Which one of these? Yes, coarctation in the aorta. Very good. They inject dye in the aorta and they see the kink. Early signs of congestive heart failure is weight gain. It's that quick weight gain, and then they're tired, their lungs are full of fluid, they're tachycardic, they're dyspneic, and they're not eating what they should. Absolutely. What's the difference between HDL and LDL? HDL is healthy cholesterol. LDL is lousy cholesterol, and that's how I remember it. So does that help you remember that from now on? Healthy and lousy. We want healthy cholesterol. Very good. Two more. Hyperlipidemia is we call it hypercholesterolemia, lipidemia. It's too much fat and fat products. Yes. And last question. Hypoplastic left heart syndrome involves the underdevelopment of what? Remember I told you this is a devastating, one of the worst type of cardiac conditions because your engine don't work. And it's the left ventricle doesn't pump. It's thickened. It's like very little. It barely gets blood out. And it is, a devastating diagnosis when parents hear it. Let's go and see how we did. Millie, number 3. Good job, Millie. Number 2, E, look at you. I knew you'd be there. Number 1, Charlotte. Good job, Charlotte. And then T and KK got in there. Good job, guys. So we are done with today, and I'm going to announce who got the 100. Who do you think got the 100?
B.
Millie did. Good job.
Who?
Millie did.
Wow. Congrats.
Yep. I was very, very impressed. She's worked very hard. Mildred, you go, girl. So that was impressive. So it can happen. And just studying between listening to the lectures, PowerPoints, and the Kahoots. You've got these study guides coming out, which are amazing every week. So good job, guys. Anything you need, let me know. And tomorrow you'll have your scores out before 2:00. So thank you, guys.
Thank you.
My pleasure. Millie, did you need to see me?